I grew up watching Star Trek and being really interested in people like Dr. McCoy and Dr. Crusher, and I thought it was really cool to combine biology and space in some way. And so one of the things I was interested in as a kid, as a 10-year-old, was going into space medicine. And so when I was that young, I kind of decided I wanted to go into medicine, and I probably wanted to join NASA and then become an astronaut doing space medicine. And then as I got older and started learning more biology and going into medical school, I realized that I was much more interested in taking care of sick people and helping them get better. So one of the things I like most about my job is the wide spectrum of patients I see, and one of the major things we take care of in retina are people with age-related macular degeneration, and so we see a lot of older patients, and we see a lot of couples who happen to have macular degeneration, and they come in together, and it's just really nice to see couples that have been married for 60, 70 years, and they're still so invested in each other and taking care of each other, and it just makes your day a little brighter to know that that kind of love exists and that kind of marriage exists. My grandfather went blind before I was born, and so he'd never seen my face, and my entire memory of him is him kind of touching my face and learning my face as I got older. And so my dad always hoped that someone in the family would end up in ophthalmology, but he wasn't able to. And I wasn't, when I first went into medical school, not all that interested in ophthalmology, and I took a year and did research at the NIH with my mentors there, and it was seeing those folks take care of patients and how kindly they treated them. And I get to do that here, and I get to do that usually once a year. I'll go on a medical mission and help learn and teach how to do various surgeries and things in other parts of the world. I think when you come to retina, you tend to be a little bit of the end of the line, because a lot of the times when people have had retinal issues, there's a lot of other things that have happened along the way, and the retinal surgeon might be the last person that can help save their sight. And so an example would be a patient we had a few months ago who was going on an anniversary trip, and she called us the day she got on the cruise ship and said that she'd lost her vision, and from her description it sounded like she had a retinal detachment, and we advised her to come back as soon as possible, and we would get her in surgery and try to save her sight. And she wasn't willing to do that. She actually ended up going on the entire cruise and coming back about 2 to 3 weeks later. And often at that point, it's harder to save vision the longer you wait for a retinal detachment. And she came in, and she was obviously conflicted. She spent all this money on going on this trip, and she just wanted to enjoy what she had while she had it. And when she came in, she was just very fearful that she might not regain any sight. And we knew that that was a possibility going in. And we did surgery, and she did well, and she just came back a few days ago and is actually seeing really well. She's almost back to baseline vision. My medical school advisor in my undergraduate school told me that I was not going to get into med school, and so I asked him, well, what if from here on I get a 4.0 and I do really well on all the testing? What do you think the chances of me getting in are then? And he sort of looked at me and said, go ahead and do that. And he clearly didn't expect me to be able to do that, and then I did that. And so thankfully I got in early for med school and was able to kind of fulfill my dream and my career path. cooking. I love to cook, and I'm trying to involve my kids in the cooking now a bit too. I like to make all kinds of food, and it's one of my favorite things to do is learn new recipes and new cuisines. I play guitar. I've played guitar for about 28 years? No, 25 years maybe. And my wife is a singer-songwriter and a musician, and she is probably the best musician I know, but she and I have co-written some songs that are out now, and it's just, yeah, I mean, it's doing all those things. In guitar, our sensibilities are pretty far apart. I started out playing thrash metal, and she plays mostly blues and jazz. But when we write, I tend to help with the lyrics more than with the music. So.